Hi, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. And we get questions all the time. One of the most common questions we get is how many times do I need to go to the chiropractor? And this is a great question, and it's vital to understand that there's not just one answer to the question. I really need to be careful, though, how I answer the question because I'm not really interested in alienating or throwing any other chiropractors under the bus. So that's not the point here. In general, chiropractic is a poorly standardized profession, if I'm being honest. That's the reason each chiropractor is likely to give you a different answer about how often you should be coming back. For example, if you have an ear infection in Dallas, Texas, and you go to the doctor, well, you're going to get pretty standard care. You sort of know what you're going to get before you go. And it is the same standard care in Dallas as you would expect in Seattle, Chicago, New York, Orlando, or San Diego. It's pretty standardized. Chiropractic is nothing like that. There is little to zero standardization, which is frustrating, but is true. So a person must really be diligent in doing their homework before deciding to go to a chiropractor. Now, some types of chiropractors are very strict about keeping very long-term plans and strict about keeping patients on that schedule, or they just won't even work with them. Now, some are more cavalier and feel the pain is the patient's pain. They give their recommendations, and if the patient takes responsibility for doing what it takes to remove that pain, well, then it's all going to take care of itself. That's kind of how I am. Now, some chiropractors make recommendations based on the idea of a subluxation theory, and that a person should go to the chiropractor many times throughout their lives because it promotes better, optimal overall health. Now, some are more focused on complaints and episodes of pain, and that chiropractor's recommendation, they'll be shorter in nature since the pain is typically knocked out pretty quickly on average. So what is my answer? Well, how often someone should go is really an individual answer. Everyone heals at a different rate. Everyone's injury is different from one person to the next person. A sweeping, generalized recommendation, well, it's not necessarily a responsible thing to offer you. However, there are some general ideas on this. Short-term pain, also known as acute or subacute pain, is less concerning. It's easier to treat. Naturally, if it's easier to treat, well, short-term pain, you would expect to not have to go repeatedly for weeks and weeks in that case. Typically, I recommend short-term pain patients come to our clinic 3 times a week for a couple of weeks as a trial period, and the complaint is most likely resolved by the end of that little trial period. On the other hand, chronic pain is more problematic. Chronic pain, by all of the experts, is defined as having pain at least every other day for 6 months. You know a lot of people that have that. Patients don't normally realize that we don't have a very large window of time before pain starts to turn chronic on us. And once it turns chronic, it becomes much more difficult to address and resolve. Typically, in chronic pain, part of the pain actually starts to exist and live inside the brain as much as it exists in the area that was originally injured. And this is easy to demonstrate by discussing phantom limb pain. Why does pain still exist in a limb that has been completely amputated and it no longer even exists? So why is pain still there? And that's because even though the leg is gone, the pain still lives on inside the brain. So chronic pain has to be addressed from a cognitive direction equally as much as from the physical treatment that we go through. So therefore, chronic pain recommendations, they're different. That's just common sense. We double recommendations for chronic pain patients. We will typically recommend 3 times a week for about a month, then down to 2 times a week for a month, and 1 time a week for a month. So we've seen pain go from something that prevents activity and prevents life all the way down to a 1 or 2 on a scale of 10. And we've seen them come off of their pain medication with the help of their medical doctor, of course. We have seen them get back to being active with their families again. And after years and years of pain, when it is done correctly and comprehensively, it can be pretty astounding. And then we have patients that they do great from day to day, but they have noticed over the years that they just feel better in general and do better day to day when they come in every now and then. That's called a preventative or a maintenance schedule. Now, I have some patients that have themselves set their schedule at every 3 weeks or so. That's just what they feel they do the best with. Some are perfect with once a month, and still some others are great with seeing us every couple of months. And that's the best news about this, is that recent research over the last 3 years or so, the research shows that people that attended appointments on a preventative or a maintenance schedule rather than a complaint or pain-based schedule, those people attended 1 more visit throughout the year, but they spent about 2 weeks less in pain. And that's some pretty cool news right there. Now, I'm not one to make recommendations like 3 visits a week for 6 weeks and 3 times a week for 8 weeks and on and on and on, or 50 to 70 visits in a year, that type of stuff. That has never been my style or my way of practicing. There are some patients that frequent adjustments like that actually do more harm than good. Really flexible, hypermobile people are a great example of the ones that don't do well with going to the chiropractor all the time. If you're sitting here watching this wondering if you're hypermobile, just Google the Baton scale and check yourself. See what you find. In some patients, seeing them too frequently throughout the year can actually be the cause of hypermobility. So it's not always a great idea, and it's not always perfect for everybody. You need to be going to somebody that knows what they're talking about. Most of this is just what I'm doing here. Most of it is just providing generalized recommendations. Overall, the better somebody feels, the less I want to see them. But you must approach going to a chiropractor like you would when you sign up to go to the gym. You know, before you ever walk into that door for the first time, that there has to be a certain amount of time and financial commitment to improving your health, or you're going to see little to zero results at all. Going to the chiropractor, it's no different. While some can just come in for a visit or 2 and they do great, a large number will take a little bit of time and commitment and consistency to see the results that we all want to see in them. It's not necessarily a pain-free life everyone is after. We all have aches and pains. All of us do. What we are after, though, is life, a quality of life. And if pain is preventing life from happening, well, then it's time to have something done about it. And the good thing about pain is it can change a person. But the good thing about chiropractic, a good chiropractor can change pain. A good, smart, and solid, evidence-based, patient-centered chiropractor is just the person to make this happen. So, if you've never been to a chiropractor, it is time to call. Give us a holler here at Creekstone. We are happy to help you. If it's been just a little while and that pain's kind of starting to creak back, you're starting to get a little bit tight, better pick up that phone and let's get you back on track, okay? Again, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. Take care of yourselves. We hope to see you soon.